Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live today, but broadcasting to you from our offices in Fairfax instead of the studio. Why? Because we're training. We're training to make life a whole lot better for you and all the things that we can do to help you. So that's why we're here, to try to give you the best care, the most optimal care, the cutting edge that we can possibly provide for you and all of our patients that are currently with us. Perhaps you've had a problem, you've tried, you've applied, you've done everything you know what to do. Well, maybe I can put a little different spin on it for you. Maybe you can ask a question that might be leading to an answer of resolution. Wouldn't it be nice to take the next step without drugs, without any kind of intervention or potential surgery? Well, the truth of it is that your body was designed in a way to be able to heal itself if you get out of the way. Sometimes we get in our own way and we set up obstacles and well, it's not going to happen to me, it's going to happen to somebody else. Well, let me tell you something. You know, you keep that attitude, it's called a problem. Give me a call today, 888-630-WMAL. That's 888-630-9625. Love to talk to you. Any subject you have in mind. I have a couple summer tidbits, and we're going to talk about that, and we're also going to talk about why you need to attend Ageless Health 2012. We're starting to fill up very, very rapidly, and I want to invite all of you that want to attend to make sure that you pick up the phone or you get on the computer, you go to rosellecare.com, or you call our office at 703-698-7117 and register for this event, because it's one that can change your life forever. The life that you have relative to your health and also of the people that you love. But before we get to that, and we have a lot of things to talk about today, we're going to talk about something called summer updates, in the news, if you will, and something that I came about this last week. Many times patients will ask me, why in the summertime do they hurt a little bit more where the warmth should make things better? Well, there's a reason for that, and it's the kind of the good news and the bad news. The good news is that when you get out in the sun, you stimulate the production of vitamin D. And the ultraviolet rays that are out there allow your body to heal. But what it also does, it can cause significant amount of headaches, because the sunlight draws calcium into your blood and actually starves the body and the body's tissue of needed calcium. Isn't that interesting? So you may have enough calcium, but it's going to start pulling it out of your bones. And so why is that? Why does it cause that? Well, see, in the summertime, you actually need, because of the ultraviolet light, you actually need more what we call vitamin F. And what is vitamin F? Vitamin F are your essential fatty acids, particularly your omega-3s. And when you don't have enough vitamin F in your body, you cause vitamin D to increase blood calcium levels above the normal level. So see, it's this balance, this thing that you have to have, at very specific levels. If that doesn't happen, you're going to hurt. Not only are you going to get headaches, but you're going to hurt all over. So if you want to get rid of summertime headache when you go out in the sun, you need to do two things. The first one is to make sure that you're getting enough water, and put a little bit of sea salt in the water. Most of you are way dehydrated in the summertime, and your body's just craving water. And we're not talking about regular salt, which is sodium chloride, because it's a negatively charged ion. It's going to bind things up, and you're going to swell. But you want to have sea salt, which has a lot of mineralization. So what you need to do is you have to make sure that those things are good. But here's the other piece. Make sure that you get enough vitamin F, which comes from essential fatty acids. Your wild salmons, if you want to do it that way, your flaxseed, your walnuts, they all have your essential fatty acids in a nice balance that your body is going to thrive off of. So a summer tidbit for you, if you want to get rid of that summer headache when you go out in the sun, and you want to make sure that you don't become, guess what, osteoporotic, then you've got to do those things, and you have to do them consistently. 888-630-WMAL, 888-630-9625. Love to talk to you on any subject that you have in mind. Want to talk to you a little bit about thyroid and heavy metal toxicity. Kind of an interesting topic, because in our practice we see a lot of different patients with all kinds of autoimmune problems, and they have this matrix where they go from an organ system problem ultimately to the structural system and so forth. And when we're dealing with thyroid problems, there's many different things that will show up, particularly when it's associated with a heavy metal problem. And we're looking at skin problems. We're talking about digestive problems. We're talking about hormone balance, headaches, depression. People will complain that they have a metal taste, a metallic taste in their mouth, and also kind of an inflammatory process. The thyroid, obviously, on examination, if it's examined properly, will have a problem. Cholesterol levels go up when the thyroid's not working, and if you have heavy metal overrides in this, you're going to see cholesterol go through the ceiling. Subsequently, you're going to end up with cardiovascular disease and heart problems, and we end up with a cascade. But here's the other piece. We're talking about low libido. It just kind of goes out the door. The evidence of low libido in otherwise a healthy person, be it male or female, often is a result of the problems with the thyroid. Thyroid will produce fatigue and diabetes and weight gain and pain all over your body and blood sugar imbalances and autoimmune problems. And we're going to talk about that. We're going to talk about uncontrolled blood sugar and how that puts you at a greater risk with thyroid problems. But first we're going to go to the phones. Joan, are you still there?
Yes, I'm here, Dr. Roselle. Thanks for taking my call.
Oh, you're welcome. Thank you for calling. How can I help you?
Well, I got a bad reading on a cholesterol report, and I'm supposed to be picking up a prescription today for lovastatin. Yep. I really would rather not take any drug if I can manage it some other way.
Well, I'm with you with that. So first of all, tell me what your cholesterol was. What was the reading on it?
336.
Okay. Is that the first time it's been that high?
I don't know. I haven't gone to the doctor the way I should have.
Okay, so that's not a problem. How old are you?
74 in September.
All right. Do you know what the other markers were? Do you know what the LDL...
I don't have everything in front of me, but I do have the LDL is 234, and the HDL is 81.
Okay. So what it's telling me, when you have numbers that high, is it a problem? Potentially, yes. Can it cause, all the things that we worry about cholesterol? Yes, potentially. Does it necessarily mean absolutely? No. So what you have to do is you have to find out why. Now, just lowering the cholesterol will do nothing to solve your problem, because there's been a lot of studies out, and what they've noticed is that they have to give cholesterol ongoingly to solve about 1% of the cardiovascular problems. It just doesn't solve the issue, doesn't solve the problem. So the question is, why is the cholesterol that high? Well, cholesterol is made in the liver. You have to have it. You have to have it for hormone function. You have to have it for brain function. And it has to do with fatty acid metabolism. It has to do with vitamin D. It has to do with exercise. It has to do with genetics. And if the cholesterol starts climbing, you have to ask the question, why is it climbing to begin with? If you can't solve that question, then what you're doing is just causing other problems because of the major side effects of statins. So what you would do is you first look at dietary considerations. Sugars are one of the primary things that will drive cholesterol. People who have a sweet tooth are going to have a problem with that. People who have a long-term history of exposures to different types of toxins and heavy metals and so forth can cause the liver not to function properly if the body can't break them down, break the cholesterols down and get rid of them. If there's no exercise, if there's no exposure to sunlight and so forth. So you have to look at it individually. Can you solve the problem without medication? In my opinion, absolutely yes. There's lots that can be done. We'd have to know a whole lot more than that. So the first thing that I would do is I would look at your diet. And, my mantra, sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives. If those things are part of your diet on a regular basis, that's going to contribate to it. If you're not getting exercise.
I have to say, I flunk on that one. I just have not really paid attention, and I've eaten late at night, and, I realized what I've done.
Okay, so it's solvable. It's just a matter you need somebody to work with you. What I would suggest that you do, we can help you. Give Sue a call in our nutrition department and, make an appointment to see her, and she'll take you through the steps. But this is resolvable. This is something that you don't have to live with and something that, you can really get a hold of. There's no reason, in my opinion, that any of us have to just say, okay, I got to take cholesterol medications because it's that high. So give us a call, Joan, and if we can help you, I'll be more than happy to do that.
I hate to interrupt, but I do have one more. I
do
know what the vitamin D was. That was low, too.
What was it?
13.
Yeah, you're way low. I would go to the health food store. I would go to Carlson. I would use Carlson brand vitamins. And even before,
what is the name of it?
Carlson.
Oh, Carlson, Carlson.
Yeah. They are a tried and true company. They're excellent. Their processing is what they tell you it is. And in your particular situation, I would start taking 10,000 units of vitamin D every day, no more than that. And as that vitamin D level comes up, by the way, your cholesterol level is going to come down. Just doing that much.
I'm also picking up a prescription for vitamin D.
Okay, they're going to be giving you 50,000 units a day. In my opinion, that's too much of a load on the liver, and you have to maintain it more than a week or 30 days like they like to give it to you. Joan, just give us a call, and I can't diagnose you on the phone, but I can tell you that a lot can be done for you. But start with the vitamin D. It's not going to give you a problem, and that will begin to bring it down. But you don't have to default to what they're doing. Joan, thanks for your call. I appreciate it. We're talking about a lot of different things today, and I'd love to talk about your problems at 888-630-9625. That's 888-630-WMAL. Cholesterol problems, you need to avoid a lot of different things, and what you need to avoid are really lousy lifestyle choices. And it's unfortunate, that we get into the rat race, if you will, that we're in, and we start making decisions to put junk. Sugars will drive your fats through the ceiling, and lack of exercise will do the same thing. Lack of exposure, particularly the sun, you need that vitamin D level, so subsequently your cholesterol level is going to go through the ceiling. If you don't get any kind of exercise, get out and walk 2 miles every day. There's many studies out there that show that if you walk simply 2 miles a day and did nothing else, you decrease your risk of dying from any type of problem by 50%, any kind of pathology, any kind of disease process by 50%. That all by itself will turn your life around so you can control it and make a big difference. But you want to avoid foods that are not organically processed. You want to avoid things that have additives and preservatives in it. Always look for organic. Increase your vegetable intake. When you look at your plate, half of it should be full of vegetables, and many of you don't eat. Many of you just simply, eat a meal a day, and then you eat the wrong things, and, eating is not a priority. Well, guess what? You've got to make it a priority. You've got to do other things that allow you to take control of your health. 888-630-9625. That's how you reach us. We're talking about a little bit about thyroid and heavy metal toxicity. Getting into the same subject, thyroid problems will react because your blood sugars are over the top. And it puts you at a much greater risk of developing what we call neuropathy, or problems with the nerve roots where you don't feel things the way you should. They become a little numb, and inflammatory reactions. So when your blood sugars go up, inflammation goes up. When inflammation goes up, guess what you're going to do? You're going to plaque. You're going to put that fat, that cholesterol, into your bloodstream. Low thyroid function is also associated with just generalized aches and pains that you wouldn't recognize otherwise. And here's the deal. When you go and you get a blood test for thyroid, your doctor probably runs TSH, a thyroid stimulating hormone test, or a T4. That's just scratching the surface. There's so much more than that. There's T4, there's T3, there's free T3, free T4, there's T3 uptake, there's reverse T3, there's the autoimmune markers for that. It was called TPOs. You have to look at the entire pattern. You've got to look at cortisol. You have to look at the adrenal function. You have to look at liver function. And all of these things come together. And we're going to put this together. We're going to kind of add the pieces the way they need to be added. And we're going to kind of educate you today, if you will, on all the reasons why thyroid and other things need to be maximized and the cascade effect that they have on other pieces of your body. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are actually at the Roselle Center for Healing today, not in studio. Why are we here? Because we're actually getting ready for you. We're getting ready for Ageless Health 2012 and trying to put together as much training as we can in our office to transition into some things that are going to be greatly beneficial for all of you. I want to talk to you a little bit about the upcoming 2012 Ageless Health Seminar, and I know we have some folks online, and I will get to you. However, Ageless Health 2012 is really special. How to live well and prosper in a stressful world. You need to be there. It's like one of the most impactful seminars that you're ever going to attend in your life. If you're really serious about taking control of your health, taking control of your life, and making a difference for yourself, for your family, you got to come. We're at the Fairview Park Marriott Hotel on Saturday, the 20th of October. It's an all-day event. We start early in the morning, and it's jam-packed. We're going to talk about the emotional side of healing as one of our presentations. Dr. Evan Mladenov, a great guy. He's known internationally. He was a doc for the Kansas City Chiefs for 12 years. This guy is amazing. Many of you maybe have run into him, and you've listened to him. He's been on Dr. Tom Roselle Live before as a guest. The guy's power-packed. He's energetic, but he's going to really teach you how the brain and the body work. He worked with athletes for a long time, and he lectures on the subject. He's written a book called Stressed Out, Headed for Burnout. And if you don't have the book, go online at rosellecare.com and pick it up. We have it there for you. But guess what? You have the availability also as a discount level when you attend Ageless Health. But we're going to learn how to eat well on the run in a stressful world. We're going to learn what happens with body injury and its effects and subtle injuries, things you don't even think about and why you hurt all the time. We're going to talk about, women's wellness and hormone imbalance. We're going to talk about diabetes and heart disease. This is an amazing program. In the morning, we start out with demonstrations on core training while you're registering. We have vendors that are going to be there. We're going to have the Chinese Martial Arts Institute with Master Burris and his crew, and they're going to do a Tai Chi Guan demonstration. It's one of the most beautiful things you've ever seen. We're going to go back in the afternoon, more demos. Lunch is on us. We're providing organic lunch, and it's inexpensive. It's only $99, and if two of you register, you get it for $179, and if you register online, you get another $5 off. So go to rosellecare.com and register for this event. You don't want to miss it. You truly, truly, truly do not want to miss this event. It's not okay for you to be standing out there trying to figure out what you can do about your health when there's so much that you can do straight up. I think we have another caller. Joan, are you there? Hello?
Mary.
Oh, Mary. Mary?
Yes.
Mary, hi. Thank you. This is Dr. Tom.
Dr. Roselle. I was getting the tail end of a lady you were speaking with. I myself get that metal taste in my mouth, and I really don't know what that is.
How long have you had the problem?
Well, it comes and goes.
Okay.
So I don't know exactly where it comes from.
Heavy metal problems can come as a result of a problem with thyroid function. It's one of the diagnostic characteristics of it, but it's diagnostic in the fact that the thyroid is being shut down due to a heavy metal toxicity problem that can come about from many things. For example, any inoculations that you've had over the years have things like aluminum and mercury that are in them as carriers, as binders, and that can get into your body, and you can begin to taste that. Depletion of essential fatty acids can cause that. But the more important thing, the compromise that we're seeing more and more, is the addition of fluorides and bromides. These are called halides, and even chlorine, and you have that in your water all the time. All of these things will cause the thyroid not to work properly, and because of their infiltration into the system, you end up with metals that lock into the tissue. The body doesn't let go of them, and you have to begin to remove them. There's ways of getting that done. But that's one of the things that is very diagnostic, if you will, about heavy metal toxicity. And if it's diagnosed properly, you can get rid of it. But it also is an indication that there's other problems that are brewing, and it can affect neurological pathway problems as well. So, we do that type of work. You can get a hold of me online at rosellecare.com. If you're not in our area, I'll tell you who else handles these sort of things. But it's something that's a heads up. It's something that you want to do something about. Mary, I appreciate your phone call. We're coming up, to the news in a break. So if you need to talk to me, get a hold of me that way. And I'll be more than happy to, tell you what I would do and how to handle it. We're here every Sunday bringing you the most up-to-date information, things that you haven't thought about, things that you can do better for yourself. And that's the whole deal. Whether it's, you don't realize that your vitamin D level is too low and it's causing all kinds of problems. You wonder why, ladies, you have that lump, in your breast tissue, and your doctor says, well, I think it might be benign. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are not in studio, but we're at the Roselle Center for Healing offices in Fairfax. Why are we there? Because we're training, getting ready for you. For Aegis Health 2012, we have our whole staff here, but more importantly, we're integrating new processes to make life much more effective, much more efficient for all of our patients and for those of you who ultimately need to come to see us and make life different. So we've been talking about heavy metals. We talked a little bit about Aegis Health. I'm going to get back to those a little bit, but to help me do that, I brought in one of the brightest I've got in my practice, Dr. Harlan Browning, who many of you have heard before, many times on the program. So he was walking by, and I said, put the headset on, and let's talk about metals.
And here I am.
And here you are. So we're going to talk a little bit more about heavy metals, and there's more people on the line, and we're going to get to them, so don't hang up. Make sure you stay there. But heavy metal problems today are all over the place. I mean, every time you turn around, you're getting something from fish to inoculants to you name it, and we're being exposed constantly. But more importantly, you're the neuro guy, and that's why I grabbed you. You like to diagnose those weird conditions, and I like to treat them. You like to look at them. So between us, we end up in a pretty good match set here. So, but what are the symptom processes? I mean, people said, well, toxicity, what's that all about, and what is that metal connection?
Well, I think the first thing you need to do is back up and look at what actually happens. The problems with metals is they accumulate. We don't clear them from the body fast enough. And the reality of it is they affect a small part of our cell called the mitochondria, which is the power plant of our cell.
The energy package.
Yeah, the energy package. And what it does is we have a process called the electron transport system that carries electrons. Electrons are energy. And what happens is metals sabotage that system. So if we can't move the energy around in the cell fails. And because the cell is self-sufficient, so to speak, and it has its own detoxification processes and it has its own repair processes, then it's going to deteriorate. And we see a cascading effect take place. One cell goes, and then it knocks down the next one, and the next one, and the next one. And if enough of that occurs, then...
People hear that, and they look at me, or they'll look at you and say, how is that possible? When one system breaks, how can it affect anything else? How can a cell in one part of your body cascade to cause other problems throughout the whole system?
Well, when the cell dies, then it leaks its contents. And that's a normal process, and for that matter, that's why we have blood work, because when we check enzymes in the blood, let's say ALT, that's a liver enzyme, that looks at how much cells are dying in the liver. And unfortunately, they can sometimes accelerate, and then we see these enzymes elevate. So
before the break, I was talking about halides, and we're seeing so many processes today that are a result of halide-induced problems, your chlorines and your bromides and so forth. And they're in everything, but it has to do, the halides now are being traced to the increased presence of heavy metal toxicity in the body because they bind them.
Sure. And,
that was something about 3 years ago, I didn't realize how bad that was. But there's all kinds of articles that are out now, and there was one that was recently in Health and Nutrition magazine. It goes back maybe a year or so ago, and they were talking about, the functional integrity, the neurological cognitive patterns that are a result of just those things we're talking about.
Right. And then with the halides, if you remember in chemistry, they're in a column, which means that they all have similar chemical components. So fluoride can mimic iodine. Chloride can mimic iodine. So if that happens, then normal thyroid function is not going to take place. So the more tap water we drink or the more fluoridated toothpaste that we use is going to slowly sabotage us.
So all of these sources of metals that we're seeing more and more in our environment, and as you said earlier, the body has a very difficult time getting rid of them, and they accumulate, and they begin to cause problems, but we can't dump them, and we can't dump them sufficiently enough so the body clears house. 888-630-9625, that's 888-630-WMAL. Love to talk to you. We have another caller, too, and Laura, are you still there?
Hello?
Hi, Laura. Dr. Roselle.
Dr. Roselle, thanks for taking my call. I talked to you before, and I am seeing my blood pressure at a record high, every day the same, and especially when I wake up, it's at its highest in the morning, and I don't know why. I'm vegetarian. I don't eat meat. I'm eating healthy. I'm taking my supplements.
What's your blood pressure? What's your blood pressure, Laura?
It's 171 sometimes in the morning, but later on it goes down to stage 2.
Okay, the blood pressure will always be the highest in the morning, no matter who you are. That's the highest of the day generally,
Right.
unless you're exercising. So it's always that. So it's 171 over what? What's the bottom pressure?
Sometimes over 108, sometimes 99, 96.
Okay,
It goes,
that's way too high, even from our viewpoint, and you have to find out what's causing that. But there are many things that can cause blood pressure, from the inability of the spinal fluid to move properly. If your skull bones aren't working properly to pump spinal fluid, or your pelvis is misaligned so it doesn't pump spinal fluid, then that pressure builds up, and it can often be recorded as hypertension. If the body is deprived of certain types of minerals and there's not enough transport going on, and anywhere from magnesium to vitamin D to potassiums and so forth, and they have to be in a fine balance, that will cause a problem. If you're dehydrated, that will cause the problem. If you're allergic to something, that will cause the problem.
Yeah,
certainly
do you have any, because I'm out of your area and it's a little too far
Where do you
from me.
where do you live?
I live in Great Falls. It's
Well, you're actually about 10 minutes from us, so you're actually very
I'm
close.
on the other side with Loudoun County.
Okay. Well, I'll tell you what. Get a hold of me on email, and I will give you a couple referrals if I can find somebody that does the work that we do. I'm more than happy to do that, Laura. So just get a hold of me at rosellecare.com, and I will go back and forth with you. Laura, thank you for calling. I appreciate it. 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're talking about heavy metal problems in the body and how they're affecting different systems. Started out talking, Dr. Browning. By the way, I grabbed Dr. Browning. He was walking around. We're training today, and I said, come on, put the headset on. We're going to talk a little bit about metals. But what symptoms would we be wary of, if you will, that are caused by heavy metals? What flags go up right away?
Classically, I look at fatigue and malaise. So a person that says, I don't know why I'm tired. This is a new thing. Something's different here. Cognitive problems, short-term memory that's not as good as it used to be.
At any age?
At any age, certainly at any age. The inability to link sentences together, like a person stumbling over their own words.
I do that all the time.
Well, possibly heavy metals.
Or blows to the head
Exactly.
and things like that nature, but that's true.
But, definitely fatigue, cognitive stuff, and then things that people don't necessarily, think about, skin changes. Because when we hold metals, then our body's going to try to get rid of them, and if it can't do it through the liver and it can't do it through urination or defecation, it's going to try to push it through the skin. So just all types of things.
A lot of rashing, particularly fine miliary rashing that almost looks like an acne but not in the body, but it's all over the system. It's not just on the face. A lot of it's on the back, which I've noticed.
Right.
And the system of or muscle extensions, so the back of the arm, the front of the legs, the back of the body, and I see a lot of that light rashing. And what it also seems to be to tie into when you have a heavy metal problem like that, it's hormone related as well.
Exactly. And one of the things that I think about with diagnosing patients, I should say two things. When a patient presents and they've been to all types of doctors and they've had the best tests in the world run, even tests that we do, and they're not being diagnosed, the two things I think about is heavy metal problems or subclinical infection like a Lyme's disease or one of those things. Those are the two, because those are the big mystery disorders that will cause tons of weird stuff to show up.
And those are things that are overlooked by most physicians.
Correct.
I mean, they come in and they say, well, here, go do this, take that, and some simple functional medicine testing will show you what it really is. And once you know, like anything else, once you have the diagnostic correct and you answer the question, why is that? It's not a matter of blunting the symptom relative to how you prescribe whatever drug it is, but it's a matter of finding out where, in fact, it's coming from, and then fixing the origin of that problem, and then healing the body up.
Right, and supporting those systems that should naturally detoxify and clear the body, because inevitably those systems are overwhelmed. So unless you get the sub pump working in the basement, if it keeps on raining, it's going to keep on filling up.
888-630 9625. That's 888-630-WMAL. Love to talk to you. My guest right now is Dr. Harlan Browning. We're at our office at the Roselle Center for Healing, and we're training just for you today. We're trying to put a few pieces of the puzzle together in a better format, in a better way, so you will be served at a much, much higher level. Talking a little bit about heavy metals, we talked about thyroid dysfunction, and that can be one of the pieces that heavy metals affect, because they compete actually for their different receptor sites within the thyroid to form thyroxine, and they get in and they replace things like iodine. And because iodine and metals kind of interchange for the same systems, and so subsequently we see patients who have a thyroid toxicosis or a thyroiditis, or what we call a Hashimoto's thyroiditis. And once you understand that, you can fix those problems.
Yeah, definitely. And another thing I think it's important to mention is, because our body needs to clear metals and it needs to use nutrients like selenium, we can deplete our own selenium stores, which in turn causes the thyroid to have a problem from converting T4 to T3, because selenium and rubidium are two important metals. They're definitely metals, so not all metals are bad. Two important metals that help do the conversion. So we can sabotage the thyroid by depleting our own nutrients.
When we're dealing with heavy metals, patients don't realize how easily they're transmitted, if you will, at high levels, at absorption through the skin surfaces, through dietary patterns, even inhalation. And we're getting these things into our body, and we can't get rid of them. It's because we're being bombarded constantly. Where, in your experience in dealing with patients, do you see many of these things come at us?
Environmentally, tap water, certainly cheap cosmetic products. We don't think about the stuff we put on our skin, but if it's coming from China, you have to ask yourself what's in it.
And those things are loaded with hormones,
yes.
too.
Certainly the foods that we eat, and then we can, it's just in the environment, walking around in your yard, you're mowing your yard, and who knows the type of pesticides that are on there, or runoff from the neighbor's pesticides. Yeah. Even though we don't put it in our yard, it's going to get there.
Yeah, we use a biological clean lawn service in our yard, but everybody around us doesn't.
Exactly.
And we get all that nonsense coming in, and the odors. We live in a metropolitan area, and even though we have great filters on our cars, it's not enough. No. It gets all of this stuff out there. Electrical sources, transformers, all of those things. Toothpaste. And when people wouldn't realize that often just brushing your teeth, you're going to have a problem that. But jewelry, just wearing rings and that are not solid, but your gold and silver. Body absorbs that stuff. It goes right into the system, and then it competes for neurological receptors.
Yeah, and then it's a slow death. Literally, we're just slowly killing ourselves because we're getting this nonstop bombardment of environmental stuff that we don't know what's going on until we develop a symptom, and we're never going to connect A to B because it might have been 25 years of this accumulation of toxicity.
Yeah, and it's a sad situation. Patients come in and we run these tests, and there's two different ways of running a heavy metal challenge. One is doing a hair analysis, which there's pros and cons on both of them. And the other one is doing a urinary purge, where you have to give a chelator based on weight and so forth. That one you have to be careful because of kidney function in some patients, and also the liver's ability to be able to pull and detoxify.
I want to touch on what you said about the hair analysis. And I used to be on the fence about the validity of the test. And now this is why I look at it more and more. I ask myself, if I do a hair analysis and it shows high levels of mercury, is that normal? Should you be accumulating mercury in your hair? No, you should not. So I find the test to be more valuable, especially because it's so inexpensive.
It is.
So at that point, if you have high mercury or cadmium or whatever, then it's you're going to take the next step, and you might do what you referenced, the 24-hour urinary collection or a challenge, because in my opinion you should not be accumulating any metals in your hair.
Not at all.
Obviously if you're using dyes and things like that, you got to look closely there, but if you don't, that's not normal.
Yeah, I was the guy that always wanted the urinary test, but again, like you, now I'm seeing more and more validity to it, and the test is much more refined. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in the office at Roselle Center for Healing today. preparing for you, preparing for many different things, including the transition from where we are today to Obamacare and the computer systems and how to handle patients more efficiently and documentation and all of that. Our entire staff is here, but we don't want to do a canned show, so we always make it live. My guest in the second half of the program has been Dr. Harlan Browning, and we've been talking about heavy metal toxicity. But what we want to talk to you about going forward is simply this: why you should be with us October the 20th at Ageless Health, because Dr. Browning is going to be one of our presenters, as he is every year, and he's brilliant. Many of you have heard him repeatedly over the years. We're filling up very quickly. Want to remind you that this is going to be presented at the Fairview Park Marriott Hotel. It's on Saturday, the 20th of October, and what you're going to get for $99. And by the way, if you register for two, it's $179. You're going to get all the materials for the program. You get to take all those home, all the presentations. You're going to get an organic lunch on us. You're going to get a gift bag that's going to have all kinds of discounts in it, and that's part of your registration fee. And not only that, but everyone that's there is going to be entered in a special drawing for a gift worth $1,000. That's right, $1,000. So you can't miss this thing. You've got to be there. If you really care about your health, if you care about the people that you love, grab them, bring them, and if you register online, you get $5 off. Dr. Browning, you're going to present.
Sure will.
Why should people be there? What are you going to be talking about? How are we going to integrate all of this thing? Give them a little snippet about what's coming up.
Well, first of all, it's going to be many presenters, and in each and every one of them, and I've worked with all these folks for a long time. They bring something different to the table. So I love sitting down and listening to the other guys talk, because it's not too often that we get to hear each other present. So, and the second thing, there's lots of good take-home stuff. You're going to be able to take home what we're talking about and implement it the next day to make changes in your life, in your health.
Immediately.
Exactly.
Yep. I mean, there's no, I have to do this or the other thing. You can go home, you can leave, and we're actually going to show you how to put together a health program and put it together the right way. Our buddy Dr. Mladenov is going to be there.
Yeah, that's going to be fantastic.
Evan's amazing. I sit there and I look at him. His PowerPoints are so funny most of the time. It's like crazy. But he'll be there, you'll be there, our entire staff will be there. We're going to have folks that are going to be there to assist you and helping you put the pieces together. We're going to be available for conversation. We have a VIP section where you're going to get to be able to sit down with me, Dr. Mladenov, and ask very, very specific questions. Go online, rosellecare.com. And we'll see you in October, and, hopefully if I can help you, you come here. You're listening to Dr. Tom Roselle Live every Sunday, 12 noon. We're here to give you the most up-to-date, cutting-edge information that we possibly can do without drugs, without surgery. See you next week. This is Dr. Tom Roselle. Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible: freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com. Did you know that maintaining a total state of wellness is a choice? That you have total and absolute control over anything that happens to your health and wellness? This is Dr. Tom Roselle, author of Ageless Health 101, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. A state of total wellness is your choice. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program. It will show you how your decisions can lead you to a life without impairment. You're in control. Health is a Do-It-Yourself Program.
Health is a Do-It-Yourself Program. Ageless Health 101. Available in paperback and CD. Featuring 3 easy-to-listen-to and follow-along CDs with bonus music selections Finding Peace and Change is Beauty. For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.